Hi, my name is Matilda Champlin, and I'll be presenting on drug-resistant tuberculosis. An overview of what I'll be talking about: the background, transmission, signs and symptoms, diagnosis, high-risk groups, prevention, and case management of tuberculosis. So on the background, tuberculosis is caused by the bacteria Mycobacterium tuberculosis. The disease affects the respiratory system, specifically the lungs. However, it can affect other organs of the body, including the spine, brain, and kidney. TB is curable, but sometimes the bacteria may become resistant to the medication due to misuse and mismanagement, and this is when drug-resistant TB occurs. Causes of drug-resistant TB include when persons do not complete a full course of treatment or do not take treatment regularly, management of TB with the wrong drugs, or treatment with poor quality drugs. The types of drug-resistant TB are multi-drug resistant TB and extensively drug-resistant TB. Multi-drug-resistant TB is when the TB is resistant to the two most potent drugs, isoniazid and rifampin. Extensively drug-resistant TB is a more severe and rare type of multi-drug resistant TB, where the bacteria is resistant to fluoroquinolones and injectable second-line drugs, in addition to the two most potent drugs listed above. According to World Health Organization, there were about 480,000 cases of multi-drug resistant TB in 2014, of which 9.7% were extensively drug-resistant TB. This is a major public health concern. Transmission of TB is via air from persons to person. Aerosols are released from infected persons during coughing, sneezing, speaking, or singing. Persons may contract TB infection after breathing in these aerosols. After infection, persons may be asymptomatic or symptomatic. In an otherwise healthy individual, the body's immune system is able to stop bacterial growth, and therefore such persons become asymptomatic, a condition termed latent TB infection. With a weak immune system, however, the bacteria multiply and cause TB infection. Signs and symptoms include cough for 3 weeks or more, chest pain, coughing up blood, fatigue, weight loss, fever, and night sweats. Diagnosis starts with a screening test, which is the TB skin test or the TB blood test. This is confirmed later with a chest X-ray or a sputum sample to differentiate a latent TB infection from a TB progressive disease. People at high risk of getting TB are 1. Persons with immunosuppression, which will be patients with HIV infection, diabetic patients, organ transplant patients, or people taking immunosuppressant drugs. 2. Persons with high risk of exposure or contact with infected persons, and that would be workers and residents of hospitals, homeless shelters, nursing homes, and prisons. 3. Persons living or visiting TB endemic areas are also at higher risk of getting TB. Prevention of TB include preventing exposure to TB, especially among people traveling to TB endemic places, to be very cautious. Prevent progression of latent TB to TB disease, which is common among immunocompromised. These people need to be treated with prophylactic medications to prevent this progression. Also, there is the BCG vaccine, which is common in countries with high TB rates. Specific to drug-resistant TB, however, is to ensure compliance to complete a treatment course with no misses or stopping treatment when persons feel better. There is the need for quick diagnosis, proper treatment, and management. Case management of TB include treatment with regimen of anti-TB drugs for 6 to 9 months with patient compliance. Treating drug-resistant TB is complicated since the bacteria is resistant to the most potent drugs, and therefore persons with drug-resistant TB should be carefully monitored and managed by experts to avoid fatalities. I hope this information was very helpful and helped you know more about drug-resistant TB. Thank you very much.